here. Hello. I'm going to wash my hands. My name is Morgan. I'm a student nurse. I'm going to identify my patient, and I'm going to check my patient armband versus my order and see that they match. Can you tell me your name and date of birth? And she does, and it matches her armband and my order. So the doctor has ordered some blood for you today. Did you sign your consent? And she has. I'm going to confirm that the doctor has provided education. Did the doctor tell you about the risks and benefits of the procedure? And that some of the signs of a reaction can include chills, itching, back pain, nausea, things like that. And then if you were to feel any of those during this time, that you need to let us know, because it could be signs that you're having a transfusion reaction. She understands that. Also, the patient is willing to cooperate and understands the procedure. Next, I'm going to get my supplies set up. I have my gloves, I have a flush, I have alcohol swabs, I have my tubing. Right here I have the signed consent that I need. Let's see here. I feel like I'm forgetting something, but we'll figure it out. Okay. I'm going to wash my hands again. I'm going to put on my gloves. Which is ever so lovely in this day and age. I'm going to assess the IV site, make sure that there's no redness, swelling, and signs of infiltration or infection. And it looks good to me. I'm going to check the patency of it to make sure that it's still okay and open, so that we can get the blood to go through it. I'm also going to check in her chart and make sure that it's the right size for this. The correct size has to be 18 to 22 in order to get blood products to go through it. And when you clean this, you want to make sure that you follow protocol per agency, and that you scrub for the right amount of time, and that you let it dry completely before you Okay, so the IV is patent, and then there's no signs of infection or infiltration. Next, I'm going to get a set of vitals, listen to lung sounds, and do a lung assessment, baseline, so that if she does have a reaction, we'll have baseline vitals to go off of. Then I'm going to get my infusion, start getting my infusion set up. I'm going to take my tubing. Nope, I'm not going to do that. Not doing it. I am going to call a second nurse, and I'm going to make sure that the blood that I received, which can't sit out longer than 30 minutes, matches the order, and everything is acceptable and up to specifications. Okay. So, my second nurse is here. So here's our paper.
Okay.
The blood here, the medical record number is 224466.
Medical record number is 224466.
Location is HLRL.
Location HLRL.
Account number is 123456.
Account number is 123456.
Patient name is Betty Jones.
Patient name Betty Jones.
And that also matches her armband. Red armband number is 456654.
Red armband number 456654.
Patient blood type is B positive.
Patient blood type is B positive.
Donor pool number is 7890.
Donor pool number is 7890.
Units in pool 4.
Units in pool 4.
Volume is 250 milliliters.
Volume is 250 milliliters.
Blood component is packed red blood cells.
Blood component is packed red blood cells.
Expiration date is 12/22 of 2020.
Expiration date is 12/22 of 2020.
Time is 2000.
Time 2000.
Donor blood type is O positive.
Donor blood type is O positive.
Compatibility test has been completed.
Compatibility test completed.
Date is 9/2/2020.
Date 9/2/2020.
All right, everything matches. Thank you.
You're welcome.
I'm also going to verbalize the need to check agency policy to use a special filter or a warming. The warmer thing. Okay. Now I'm going to take my tubing. Make sure all my clamps are closed, because that's a lot of fun when they're not. Checking the expiration date on the bag, and we are good. There's no floaties or tears or holes in the bag. Good, okay, that's closed. That's open. We'll open that up. And saline has to be above the level of the filter in order to prevent destroying red blood cells. Which it is. I'm going to prime the tubing. Make sure the cap on the end so it doesn't get contaminated. I'm going to take my blood and rotate it, or agitate it a little bit. Check for bubbles, clots, any abnormalities, or any change in color, and it looks good. Check the expiration date one more time, make sure that that's good. making sure to not contaminate either end. Select the bag. Good. This way. So now we can open this one. Why are we not flowing here? Open. Open, open, open. Open, 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 open. What's going on here? In real life, I wouldn't squeeze this, but what's the deal here? Well, and you want to make sure you don't waste any blood. You want to get it just to the very end, so that okay. Well, you're really nice, huh? I know, right? See it?
Yeah. Thank you.
Maybe. Yes. Let's search this. E. Whatever. Confirm. Channel select. Guardrail fluids. Red blood cells. Blood RBC selected. Yes. And then for the first 15 minutes, it has to infuse at 50 mLs per hour. After that, it can be increased based on judgment or physician order. So I'm going to start the infusion at 50 mLs per hour, and then the volume to be infused can just be whatever, because it's only going to infuse at that rate for 15 minutes. Then I'm going to take my alcohol swab and my tubing. Goes in the garbage. That also goes in the garbage now. Swab my port again. For however long according to company policy. Let it dry completely. Make sure it's attached securely. Make sure all your clamps are open. Open. Saline is closed. And push start. I will remain with the patient for the first 15 minutes to observe for signs of reaction. After that, if there is no reaction, I can increase the rate, as I mentioned before. I will monitor vitals every 15 to 30 minutes. I will document the volume that infused, the start time of the infusion, the end time of the infusion, the gauge of the needle, the location of the needle. Once all the blood has infused, I will stop. I will pause the infusion. I'll hit channel select. I will change the volume to be infused. I'll close the clamp on the blood. So I'll open the clamp on the normal saline because that's the only solution that blood is compatible with. I'll change my volume to be infused to about 50. And then I'll hit, my rate will be different because it'll be going faster by this point. I'll hit start, and then that way all the blood that's in the tube will get infused to the patient. And then once all that is in, I can discontinue the infusion completely, remove the tube, and do my charting, where I will include everything I mentioned previously, and some lifespan considerations. If I had a pediatric patient, I wouldn't infuse, the volume would be less, or hopefully I'd use a 22 maybe instead of an 18, and I would remove my gloves, wash my hands, make sure that the bed is in the lowest position, the patient has his or her call light, and is comfortable, doesn't need anything. And I believe that's it.